I am the president for programs. I have oversight of several programs, including this initiative that we are going to talk about today. And Paul, would you please introduce yourself?
Sure. Hi there. This is Paul Baker. I'm Senior Director for Programs here at the National Alliance for Hispanic Health. I work closely with Magda on a number of our health outreach and education initiatives, and we're just really happy to be joining you today. Thank you.
Hi, I'm Flor McKinley, and I work at the Helpline as a health promotion advisor.
Thank you, Flor. Macon.
Hi, my name's Macon Lohman, and I'm the Deputy Program Director here, so I work closely with Paul and Magda as well.
Okay, thank you so much, and again, thank you for being with us today, and for letting us use your time to talk about our program. So we move to the next slide, please.
And I gave you control over the slide.
Oh,
so
did you?
Be able to click
okay,
through it.
Let's see. We didn't check that out. Okay, how we do that? Ta-da.
You should. We'll
we got it.
Great.
Okay. So the agenda for our 15-minute presentation is I'm going to talk about the Alliance for a couple minutes, so you know who we are and what is our organization all about and why we are interested in this issue. And then Paul is going to talk about the H2A outreach initiative and the partnership that we are seeking to have with the state monitor advocates to actually reach this population with the ACA messages. So about the Alliance, the Alliance is the largest and the oldest network of human services providers serving 50 million Hispanics in the United States. We work to ensure that health incorporates the best science, culture, and community. We do this by listening to the individual, investing in leading community-based organizations, working with national partners, examining and improving the resources and systems available, and finding solutions to make health a part of a person's life. We constantly work to improve the quality of care and its availability for all. Okay, the Alliance is proud of what we have. We are proud of our community that we serve, our bipartisan board of 12 members, our members, which are mainly community-based organizations, health-oriented organizations, universities, many government agencies, and many individuals that want to be part of our mission. Have a very sound, exemplary financial and administrative process to ensure our programs are managed according to the funding provided by either government or private corporations. And we're guided by some important values. Our relationships are consistent with our mission. For example, we do not accept any tobacco or alcohol funding or for any of the subsidiary companies under these issues. We also believe in the power of local communities to identify their problems and bring up solutions. Our programs and policy are driven by science and community voices and experiences. We are also proud of no-partisan and non-political organization that we are, and our programs focus on doing what is best and needed in our community. So we have supported in the past programs that have been created under a Republican government or a Democrat government. As long as it's important for our community, we support the initiative and ensure that our community benefits, as it is now the case of the ACA marketplace. So at the Alliance, we have two kinds of programs. We have the signature programs, and these programs reflect who we are and are guided by the community needs. This includes the Su Familia, which is a program sustaining our initiative with the Farmworkers, and Paul is going to talk about it about the helpline in particular. And there are other signature programs, but I'm not going to spend time talking about them because we need to focus on the other issues and the time is short. We also have demonstration programs, and these programs focus on issues and are funded by both government agencies or by corporations. These programs address a wide range of issues such as cancer, diabetes, heart disease, hypertension, you name it. We have many programs that are all implemented at the community level, and for the most part, they are multi-site and multi-year initiatives. So this, I think, I'm going to pass the mic or the phone to Paul to talk a little more specifically about the Su Familia operations and the H2A outreach initiative.
Thank you, Magda. Su Familia, or Your Family, the National Hispanic Family Health Helpline, is operated by us here at our national headquarters, and we offer Hispanic consumers free, reliable, and confidential health information in Spanish and English, and help navigate callers through the U.S. healthcare system. We have nationwide resources and local referral services, which we provide depending on the needs of the caller. It's helpline is staffed by a professional team of bilingual and bicultural health promotion advisors. Our helpline staff, alliance employees, and we use a patient navigation model to provide information on really a wide range of health topics, including ACA-related issues. Basically, using a caller's zip code, we can search our database of over 10,000 culturally efficient community clinics, hospitals, health centers, and other resources to be able to refer consumers to these facilities in their communities where they live, as well as other local services for example, one-on-one assistance with enrollment in the Affordable Care Act's marketplaces. We really provide consumers with practically any information on any health topic you can think of. Developed a wide variety of bilingual consumer materials covering cancer, cardiovascular disease, immunizations, diabetes, HIV/AIDS, mental health issues, etc. Our helpline operates from 9 a.m. to 6 p.m. Eastern Time, Monday through Friday, and we do have some extended hours during marketplace open enrollment periods. And of course, when we're not open, voicemail system takes messages and we return those within the next business day. So the Alliance has partnered with the National Center for Farmworker Health under a supplemental grant award from HRSA to provide information and health insurance plan enrollment assistance to a very special Hispanic subgroup, the migrant seasonal farm workers that are currently residing and working in the U.S. With H2A visas. We are a CMS-designated certified application counselor organization, so we assist Hispanic consumers on health insurance plan eligibility, application, and enrollment processes through our toll-free helpline, which we just went over. As I'm sure you know, H2A temporary agricultural program allows employers who anticipate a shortage of domestic workers to bring non-immigrant workers from out the U.S. to work temporarily or seasonally on our nation's farms. And there are currently around 30,000 of these workers in the country right now, and all are intended to be covered by U.S. wage laws, workers' compensation, and other standards. So in addition, they're eligible for enrollment in health insurance plans through the marketplaces. And as lawfully present individuals, H2A workers have rights and responsibilities under the ACA. However, the problem is that these workers really have limited access to U.S. healthcare system information and few opportunities to encounters with health outreach workers and healthcare professionals. So the resource that we provide through our helpline on this topic can be very useful to this particular group. Primary goals of the H2A Outreach Initiative, just briefly, are to increase knowledge and awareness of health insurance marketplace plan opportunities among Hispanic H2A workers, which consists of providing accurate eligibility, application, and enrollment information to those workers with H2A visas, as well as their employers, primarily through calls to our helpline. In addition, we facilitate individual consumer health care navigation services for those workers in need of services. Specifically, we can look up and research appropriate provider referrals based on their needs. For example, for H2 workers, some may need to see a doctor before they're enrolled in a plan, and we help them to locate low-cost or sliding fee scale services where they live. Other H2A workers, perhaps are exempt from purchasing a health insurance plan because their income falls below the required threshold, or they can demonstrate a particular hardship, and therefore they are also referred to low-cost health services in their community. And for some H2A workers already, under or enrolled in a qualified health plan, we can help confirm, which providers are in their plans, help to address problems that might arise accessing health care through their plans, in addition to sort of general information and guidance on questions they should ask their providers during appointments. In addition, we can refer callers to the National Center for Farmworker Health's Call for Health program, which is actually another call center that provides information for migrant seasonal farm workers and can provide some limited financial assistance to help with the cost of some of their medical services. Finally, this initiative, one of our goals is to collaborate with local, state, and national organizations and community and migrant health centers to increase their capacity to provide accurate outreach and education to H2A workers and their employers on obtaining health insurance, to increase their access to health care and other related services through provision of webinars and consumer materials. And as Magda mentioned, after this webinar, we will be reaching out to the 13 states with the highest numbers of H2A workers currently in the United States to help support you all. We're going to be reaching out to you all that are located in those 13 states to support your outreach to H2A workers, and see if we can send you some resources for distribution, and to invite you to participate in a webinar on H2A as it applies to MSFWs. Because H2A workers are lawfully present, they are, as I mentioned, eligible and in most cases required to have minimal health insurance coverage. And so unless they're exempt, they'll be responsible for paying the fine, which is called the individual shared responsibility payment, for being without insurance for more than 3 months during the year. However, if an H2A worker doesn't qualify for coverage due to their income, below the filing threshold, affordability, etc., they can request that exemption. Sort of unique for H2 workers is that they're eligible to purchase a health insurance plan through their state or federal marketplace through a special enrollment period, or SEP. SEP is used in specific circumstances so that individuals can apply for and obtain health insurance plans outside of the traditional or the normal open enrollment period. And so in the case of H2A workers who arrive in the U.S., in many cases after that period is over, they qualify for an SEP. And in their case, that means they have 60 days to apply for and enroll in a plan through the marketplace after their date of arrival. Helpline, provides H2A workers with different types of information and education on various issues related to the health insurance and insurance plan eligibility, application, and enrollment processes. And you can see here some of them, from Health Insurance 101, basically educating about concepts, terminology, responsibilities, a general overview of the ACA, its purpose, and what it's also known as, health insurance marketplace, the difference between federal and state, how it works, when and ways to apply and enroll. Eligibility issues, prepare for the application and enrollment process and the documents you need, selecting a plan and the comparison of plans, and the differences in coverage, premium tax credits, and then what happens after applying and enrolling during the year after that open enrollment period or after their special enrollment period has ended. The appeals process, reporting changes in their life or income, and taxes. Exemptions, of course, is another big one. So as I mentioned, the Alliance, through this program, can provide a number of services and resources for partners like state monitor advocates to assist in outreach to H-2A workers about health insurance plan opportunities, health information, and healthcare provider referrals. So some of these ways we've gone through already today, but basically the main one is referring Hispanic H-2A workers to our helpline, providing webinars for healthcare providers, migrant health center staff, H-2A employers, and other stakeholders on how the ACA applies to H-2A workers, and then printed bilingual consumer materials on health insurance plan rights and responsibilities for H-2A workers with our helpline phone number for additional information. That concludes our presentation. Thank you very much.
Well, I would like to add just one sentence to this. It is that we really are, our purpose today is to really seek your support in providing some of this information to the farm workers so they can actually call our helpline for additional information, and we can guide them through the entire process. But we would like to hear from you what is helpful for you to give to your promotoras de salud that I understand you have under your management, and for them to actually put this service or provide information that they need. In addition to having the webinar with the promotoras or with state directors or whatever, what other things do you think it will be useful for us to do in order to get this moving? So we would love to hear some questions if you have any, or some ideas.
Thank you much, Magdalena and Paul. The information here, I think, is really valuable. It can be really valuable for our state advocates, and especially for the outreach workers who are going out into the field and communicating on a daily basis with the migrant and seasonal farm workers, many of whom are H-2A workers. So I definitely want to open it up to the audience to be able to answer some of the questions that you posed. And if anyone wants to open up their line, you just need to press *6. Thank you.
Hello.
Hello. This is Billy Green in North Carolina. How are you doing today?
Fine.
Me okay?
Yeah, thanks, Billy.
Okay. Oh, yeah. I was thinking as far as add to the little reach toolkit would be, in past experience shows like a little wise card with the information. A lot of agencies like our agency and others in North Carolina, we got a beat that's got, all the resources of agencies, service agencies, enforcement agencies on one on front and back, and it's in Spanish, English, and that's good. But as far as something like the health services, I think probably it would be like a little wallet-sized card with the information on it, where they could slide in the wallet. That's something I just thought I would, put on the table.
Good idea. Yeah, I like, having a different size card they can just easily carry in their pocket or in their wallet.
Okay.
Hello, this is Dunia from Idaho.
Hi.
Hi, I have a quick question for you. We do have a lot of H-2A workers here in Idaho. We have a law that is kind of recent, since 2014, that limits our outreach in the fields. So because of that, we have been doing mostly radio outreach, and that has been challenged. But in the meantime, we do using radio. And I was wondering if you have like a PSA. We have good contacts with the radio stations here, and we could ask them to run those if you had anything like that.
Well, go ahead, Paul.
Well, I don't think we have anything developed right now for radio, but that's something we could investigate. We certainly work with vendors who could help us put something like that together. Let me ask you, what kind of announcements are you currently using with radio?
Right now we are doing like radio shows. This year I have kind of like been training the outreach workers to use the radio, so I accompany them to a radio show and I do one with them. Then I tell them that they need to continue doing it. We have had PSAs in the past, very short ones that just tell, the basics like what services we have and that we have a complaint system. We have completed those pretty much in-house.
So within announcement you list, or within that the radio show, you list a phone number to reach your agency?
Pretty much. Yeah, that's with the shows we do question and answer, and we present like a little topic with the show, and then but then we always share the phone numbers for people to call, and they do. Usually we see large number of follow-up calls after we do in a particular area.
Right. Yeah, I think one of the main benefits of our service, which we've heard from others that are out in the field, is that if people call our helpline, we can do a lot of that upfront education, and sometimes our calls last up to an hour. And we know that resources are limited out in the communities and in the field, and so all of that education that we can provide up front will save you all time if you're a navigator, or even if you're a sister, in terms of how many people you can see and help on this issue in a given amount of time. So
surely share that helpline that you have, and I'm going to send this information to the outreach workers throughout the state, so that they're that, and probably to my radio contacts, and maybe with the brochure or something, so they can share it. But it would be nice to have something that is ongoing, because we do our radio show like once a month or something like that.
Yeah.
Okay.
Yeah, we also could, have interviews, with our specialists here on the issue.
That would be great.
Yeah, with the radio interviews, if you connect us with the radio.
So I can definitely do that, like send you the contact information for the radios that have been helpful to us. And they would do that because they're willing to do interviews over the phone. We have some of those.
Yeah, can I ask you another question? What is your name? Are you in the list of the state monitor advocates?
Yes.
Okay.
Name is Dunia. Dunia. D as in David, U, N-N-I-A. I am from Idaho.
Okay. Well, thank you so much. I think those are great ideas, and we can talk and see how else we can support that your outreach also to the H2A workers.
Okay. Thank you.
Thank you. Any other questions? Anybody with great ideas? Great ideas.
Hi, this is from Connecticut. Can you hear?
Yes.
Hi. I do appreciate your support in this. I do have a couple questions. And that's because I've done outreach directly to the workers myself. When one of these H2A workers has to contact the marketplace, a typical in itself is taking an hour to an hour and a half per person. You get your hotline when you got advice. That call in itself takes another hour or so. And what are the hours of the hotline? Because in line with the worker's schedules, then it becomes really it's really not advantageous as it would seem to begin with.
Well, yeah, I had mentioned in my part of the presentation that our hours are 9 to 6, Monday through Friday. That's Eastern Standard Time.
Mm-hmm.
So we know that those are limited hours, and that it's not just for MSFWs, but for a lot of people in the communities we serve. Being able to make calls to our helpline during those hours can be a challenge. So unfortunately, we have a huge way around that, except we do make every effort to call people back when they tell us a good time to try and reach them.
Yeah, but that's within the 9 to 6 schedule, correct?
That's right. So
just so you know, you're hampering yourselves within the program in itself from the get-go.
You understand that we have that limitation.
So the H-2A workers, because the H-2A workers like to put in as many hours as possible, so as soon as any extra hours are offered to them by the employer, most likely than not, they're taking these hours.
Right.
No, we understand. I mean, these are issues that we've dealt with for many, many years, not just with H-2A workers. I think that once people understand that they'll be paying a fine if they enroll, they may be more motivated to take some time out of their very busy day to make sure that they get the information they need.
Yes, that is correct. It's also very advantageous for them to understand how much that fine will be, and if it becomes, or if it's vital to them at all to take on the health insurance plan.
Right. Many of these workers qualify for the subsidies. So it is to their advantage really to find out, and then they will have health insurance, which is the bottom line. Can I ask you which state are you calling from?
This is Connecticut.
Well, you're on the East Coast, so it wouldn't be a big issue in terms of the hours. If they can fall said, we can call them back at a time that is a little more convenient for them. We will make an effort.
So this is 9 to 6. What zone?
Eastern. We're in the.
Oh, this is Eastern.
Yeah.
Okay. Well, that wouldn't. That's the issue I'm dealing with the marketplace to begin with, is that the marketplace is typically open when they're working. So it's very for them to call in.
Yeah,
they bring up a good point.
Take a 5-minute call and let us know that they need to talk to us. Make an appointment for us to call them later. We will make an effort to do that.
Okay. Can I just make a suggestion based on what you have commented on? You said you're trying to educate people or groups of people. You'd set up in meetings with the larger employers, and instead of having each individual call in, you would be addressing a large group altogether.
Yeah, we're trying that, and it has been very difficult to get. You can help us with that. That will be fantastic, because we've been trying to get the employers so they can actually do some of the education. But after my conversation with Juan Regalado, which was wonderful, I see the opportunity also to get through the state monitor advocates is good, because you have also educators going into the community, and to them, if we provide training to them, they can also provide information to the agricultural workers.
Okay.
Oh, hi. Hello.
Thank you so much to Magdalena, and you guys bring up some really good resources, some really great points, and I know that there is more interest in on the state advocate side in, it looks like, asking you some more questions, but we need to move on right now to our next presenter. So if, for those who do have additional questions, you feel free to submit them to me, and I can send them, or Magdalena and Paul, is there a good place where they can also send additional questions?
That will be great. In addition, they can send us all the questions. You can call me, call Paul, and if you can provide our phone numbers, will be fantastic. And also, we will be contacting all of you, especially the people in the 13 states that we want to reach. So expect our call.
Thank you, Eliana. Thank you, Magdalena. Muchísimas gracias. Thank you, Paul. I think this is great information. Right, Magdalena. The next step will be for the operation between you and each of the state monitor advocates. So you continue this discussion, but I think this is great information. And again, like Eliana mentioned, thank you very much.
No, thank you.
We'll continue to chat for later on also.
Okay, thank you so much.
Thank you. And I have Luis Guerra from the United Farmworkers Foundation here to show us some of the what we do and possible ways for collaboration and provision of services. So, Luis, do I have on the line? And you're on the line. You can press star 6. Yes, great.
Thanks
for joining us.
Thanks for having me, both Juan and Liana, and thank you for providing me this space to share a little bit of what we're doing locally in California, but also at a national level. Are seeing my live presentation now?
It's up on my screen, so
okay, great.
Hopefully everyone else can see it. Can others? Okay, great. And
right.
Luis, I have given you control of the presentation.
Thank you. I'll go ahead and get started then. Don't want to take up too much of your time, but want to thank you again for providing me this space. My name is Luis Guerra. I am the Immigration Implementation Coordinator at the Farmworkers Foundation. Apologies for a typo. Quite embarrassing that I misspelled our own name, but it is the United Farmworkers Foundation. At the Farmworkers Foundation, our sister organization to the United Farmworkers Union, and we're part of this large farm worker movement. A lot of you are familiar with the United Farmworkers and the work that Cesar Chavez did in providing rights to farm workers around the work issues specifically. But the United Farmworkers Foundation, we focus more around the legal services, especially around immigration. And today I'm hoping to share with you how we're getting prepared for one of the largest immigration programs ever, and also giving you a little bit of insight of other services that we provide, just in case you're one of our regions or offices, or maybe I can connect you with some of our national partners or local partners in other states if you want to increase your outreach efforts. So we have this accreditation and recognition called the Board of Immigration Appeals, recognition and accreditation that's provided by the Department of Justice. It also to practice immigration law and give people legal counsel without having an attorney on staff. It's a rigorous process that our staff goes through to get this recognition from the federal government, and it allows us to give legal counsel on immigration matters, and we take that very seriously, take the confidentiality of our cases, and won't practice outside our legal scope, and do work closely with a lot of immigration attorneys in each of our regions for referral purposes. We have offices in California, mostly in Salinas, Bakersfield, and Fresno, but we also have an office in Phoenix, Arizona. I'll speak a little bit about our other partners that we partner with. So not only do we provide direct legal services, we also believe in organizing efforts such as civic engagement, advocacy at local, state level, and national level. We do a lot of leadership development with our farm worker leaders. We are focusing a lot at a national level with coordination of implementation efforts for large-scale migration programs and figuring out how we're going to reach as many farm workers as possible with the programs that I'll be covering today. Many of you have probably are aware already that on November 2014, President Obama announced a large deportation relief program that's estimated to assist over 5 million undocumented immigrants. Out of those 5 million undocumented immigrants nationally, we're estimating about 700,000 of those to be farm workers or direct relatives of farm workers. This, like I mentioned, this is the largest immigration relief program in U.S. history. We are continuing our efforts for long-term relief, hire 11 million estimated undocumented population, but also are aware that when I go over these programs that I'll briefly cover, that they're not a pathway to citizenship, they're not a pathway to legal permanent residence, really just deportation relief that provides social security numbers and work permit for 3 years once they're implemented. They shape or form what we hope to get with our advocacy efforts, so we're going to continue to push for immigration reform. The program that was established by President Obama in 2012 is called Deferred Action for Childhood Arrivals. The acronym that I'll be using is DACA. Many of you may already be familiar with this term, but the DACA program was created in 2012 to provide deportation relief. It's currently a program that's still available that many of our farm workers have been able to apply for, and many of their children may be aging into as you all go through the guidelines. One of the requirements to apply for an immigration program is that you must be 15 years old to apply. So there's a lot of farm workers out there that don't realize that their child might be aging into this program, and it's a great benefit to them. So the guidelines to qualify for DACA, the individual must prove that they were under the age of 31 as of June 15, 2012, when this program was created. The biggest barrier for many of our farm workers is going to be that they have to prove that they came to the U.S. before reaching their 16th birthday. So the program is really geared to those that arrive at a young age. They're going to have to prove that they've been in the U.S. since June 15, 2007 up to today, whenever they were going to apply. Obviously, they're going to have to prove they have no lawful status, meaning they are undocumented and were undocumented when this program started. There's also an educational component that we've seen be a barrier for our farm worker communities, but there's a lot of flexibility in what type of programs and what one must prove they're enrolled in. You don't have to have qualified or graduated from a high school or obtained a GED. At the minimum, you just have to prove that you're enrolled in a school program and trying to achieve that as an ultimate goal. And there's always criminal considerations that take place that one must deal with each individual case when it's applying for an immigration program. President Obama's executive action that he took on November 2014, he essentially is expanding this DACA program that is already in existence. DACA program is you still have to prove that you came to the U.S. before the age of 16, but now instead of the date of entry being June 15, 2007, it's being moved up to January 1st, 2010. So a lot of people that maybe didn't qualify before because they were new arrivals to the country may qualify once this program is implemented. There's also a removal of the age cap. So there's another barrier that we had with our farm worker families. A lot of people were over the age of 31. So that will no, once this program is implemented, that will no longer be a case. This program where we expect the big chunk of the 5 million individuals to to is what was called the Deferred Action for Parents of Americans, also called as the DACA program. This program is very similar to the DACA program that's in existence. However, the guidelines are a little bit different. They're still going to have to prove that they arrived into the country on January 1st, 2010 or before. They're going to also have to prove that they have a daughter or son or daughter, doesn't matter the age, that on November 20th, 2014 was a U.S. citizen or lawful permanent resident, which means a green card holder. And once again, criminal convictions and stuff like that will affect what folks qualify for or whether or not they should move forward with this form of relief. Right now in the news, there's a lot of talk about the lawsuit that's happening, and essentially these two programs, the DAPA program and the expanded DAPA program, are currently in the court system. We have full confidence that once it goes through the entire appeal process, it will come out and implemented. So there's a question about when this program is going to actually go into effect, and I don't have an answer for that today. However, there's what I want to share with you next is there's a lot of efforts happening to make sure that whenever these programs are implemented, they're as prepared as possible to help as many immigrants and farm workers as possible. So we are preparing our implementation efforts at a multifaceted strategy. The United Farm Workers Foundation is part of national, state, and local efforts. So any of you want to get more information about the efforts that may be happening in your state and how you might plug in, you can feel free to reach out to me and I can connect you with other partners that are working on these issues. The greatest resource for all of you I know that I quickly went over the guidelines and requirements, but if you want to refresh yourself, if you want to print out, sample flyers and presentations just to have available if someone were to come to you, the best resource center that we collectively at a national level with our partners have developed is the website that I'm showing to you now. It's called www.adminrelief.org. This website is meant really for giving to potential applicants. It's more geared to immigrant advocates or people in the community that want to help farm workers or immigrants navigate this system and how to prepare for it. So a lot of great information, a lot of great resources are available for you and to be downloaded on this website. I mentioned that along with our national coordination with our immigrant partners through what we call the SERI network, that we've also developed what we're calling the CSOA network that's more focused on farm worker issues and making sure that we increase the capacity of legal services in rural areas, increase the training and technical assistance to organizations, individuals that want to provide this type of legal assistance to individuals once the programs are implemented, and the vast communications messaging along with our advocacy and continued regional collaboration efforts. The CSOA network its main purpose is to directly engage and build long-term relationships with farm workers, their families, and immigrants and farm worker communities. We all in the CSOA network really believe in working towards systemic change. The hope is that through the CSOA network, we're going to maximize the effectiveness that's happening with our larger coalition partners, but really focus resources and materials and messaging in farm worker and underserved areas, making sure that our farm worker communities are not left behind. Along with the CSOA network, we partner with national and statewide organizations that work closely with farm worker communities, such as Farm Worker Justice, Model, AFOP. Others that you might be more familiar with locally are organizations like Proteus, CT, or Florida Legal Services. We have a vast we're hoping to increase the network and make sure that organizations and individuals are plugged in into these efforts to ensure that we increase the accurate and reliable information around immigration to our worker communities. One way that we're hoping to increase the awareness and information is through outreach materials that I would be more than happy to discuss offline with any of you if you would want to get some of our outreach materials, and we can work that out. This example that I'm showing with you right now, it's an outreach material that has a 1-800 number that individuals can call if California will try to make a consultation with them on their issue, and if they're not in California, we'll refer to a trusted partner. We also have a text messaging campaign. It's the 877-877 number, and individuals text the word "list" to that number. They'll get plugged into our national farm worker text messaging system that's specifically just to keep them updated on farm worker immigration issues. So as soon as these programs do start up and there is a place to go get assistance, our hope is to reach as many folks through different modes and means. So our text messaging system is growing with the help of a lot of our partners, and we're hoping that this is going to be one of the great tools that we're going to be able to use with folks to reach out to as many folks as possible. And then on the back side of this outreach material, there's a list of documents that individuals can start preparing. There's a lot of preparation work that our farm worker communities can start doing in organizing the documents that they're going to need once the immigration program is available. You as advocates and as trusted partners in our farm worker communities, we need to continue to spread the message of making sure that people are getting reliable and trusted information. There's a lot of fraudulent individuals out in our communities that are trying to take advantage of our farm communities and promising them assistance for this program, or them they can be first in line, etc. There's a lot of farm worker communities need assistance with accessing identity records, such as their birth certificate, photo IDs, etc. So we really recommend that all of those individuals that don't have those types of documents that are listed in this toolkit start collecting those, because some documents may take up to 6 months to get, and we don't want individuals to be panicking once this program is implemented to try to get all those materials. And just to close off my presentation, just a reminder that adminrelief.org is really meant for all of you to use as a resource. It has toolkits. It also has a National Legal Service Directory on there for trusted immigration legal service providers that you can all use as a resource if you ever need to refer someone to get legal advice in your state. We also have csepwede.org, which is a Spanish community site with up-to-date information regarding these programs and other immigration programs. And like I mentioned before, the text messaging campaign, text the work list to 877-877. And I'll just open it up for questions or comments, and I'll put up my contact information in case anyone wants to reach out to me directly offline. Thank you.
Thank you so much. This is really helpful. It provides our state and regional monitor advocates some additional resources so they can know where to go to find all this information, and also to share this information with outreach workers, and in turn get the information out to the seasonal farm workers. So we certainly appreciate you taking time to explain all that you're doing to us. And I would encourage anyone, we've got a few minutes left for questions. Just press *6 if you would like to unmute your phone and ask a question.
Hi, this is Juan, Luis. Sorry about that. This is Juan. Thank you so much, Luis. This is, again, as I mentioned, great information. So if we have any other questions, now's the time to ask the question to Luis. I'm also in the chat room, and it doesn't look like we have any other questions. Other Luis?
Oh, thank you all for your time again. I do hope to hear from you, some of you directly. I'm open to ideas on the way to partner. I forgot to mention each of our offices has an outreach staff, and most of our partners have outreach capabilities as well. So I'm just curious that if I may know of a organization that you want to get plugged in with an organization in your state, don't hesitate to reach out. I may or may not have a contact there, but I'm hoping that I'll be able to be of some help.
Thank you so much. And if we get any questions in after the call, I'll be sure to loop you in or to reach out. Anything come in later. So thank you so much for your presentation. Thank you. And because we have just a few minutes to go over just a couple updates from national office. The first update is in regards to leaders. I know that many of you have been having issues with leaders and its ability to compute cumulative data, and unfortunately, it has not been fixed yet. We know that the due date is coming up, and we just want you to know that if yours is not fixed before the due date and you submit, you're able to submit the data after the due date, your reports will not be considered late. Of course, you cannot consider them late if you cannot submit it. So it's certainly only fair to you all that that be considered late. And once we receive the green light that the system has been fixed, we let you know, and we ask that you have all of your data all prepared and ready to go, so that once we give you green light, you can basically hit send. So yes, there may be a little bit more time. We don't know how long, because we don't know how long it's going to take them to fix the system, but please have all of your data ready to go, and once we give the green light, then you can go in and submit everything. So beyond that, as I receive any additional updates, I will be sure to pass those along, and hopefully we'll get some good news sometime soon, though I know IT issues can be time-consuming and frustrating. Item, yeah?
This is Chance from Vermont. How you doing today?
How are you?
Good, thanks. Is there going to be anything going out in form of an email just notifying everybody of the difficulties and the potential for filing after it's up and running? I know my boss has always asked me when the reports are going in, so.
Yeah. So your regional monitor advocates should be set that out, and we'll be in touch with the regional monitor advocates as well. We got it with them yesterday, so you should be receiving something shortly.
Thank you.
Hi, this is Maricela from Florida. I had a question.
Yeah.
In the past, we received a list or a chart of due dates for the LEARS and the 9002. Will you be getting something like that for the upcoming due dates?
Can you answer that question?
Yes, we had the same. Hi, Maricela. We had the same question from the regional monitor advocates. That it was a document that our former colleague, or not former colleague, Ted Roberts, put together. But we'll definitely update it and send it out as soon as we have the future dates for the due date. So we'll send it out here hopefully in the next